So we're going to start talking about ultrasound now. Ultrasound is now taking sound waves and implementing it, driving it into tissue to make the tissue change. Now, sound waves are pretty cool. We'll look at some examples of it. I think we can see how sound waves can affect structure. If we watch this, so this guy's clearly a scientist. We know he's a scientist. Wearing a lab coat. Yeah, if he was a musician, he wouldn't be wearing a lab coat, right? So we also know it because he's wearing goggles. Musicians don't wear goggles. So he's introducing sound to this. I gotta turn my. So look at that. We're introducing sound waves and it's causing the structure to change. There we go. That's what we wanted to see. So we can see how sound waves we just saw how it can impact structure, right? So all it was the energy of sound waves causing that glass to vibrate back and forth, and eventually it exploded. So that's fun. Hopefully we're going to stop short of that for our patients. Show them that video. All right, here's what ultrasound is. Let's watch this video of glass breaking. So what ultrasound is, it's a high frequency sound wave at a pitch that's too high for human ears to hear it. The audible range is up to 20,000 cycles per second. The ultrasound range is between 1 and 3 million cycles per second. So a hertz is 1 cycle per second. So that's 20,000 hertz. We are at the megahertz, which is 1 million to 3 million cycles per second. So we're not going to be hearing it. So the sound energy is transmitted as a wave. It can pass through water, gas, or solid matter. Energy wave will compress and then spread out molecules as that sound passes through. And that's what we saw with that glass. You saw that glass kind of shrinking and expanding and shrinking and expanding, having that wave-like appearance to the glass itself. So that vibration, that compression and expansion of these molecules is causing a collision with neighboring particles, and that's going to create the effect that we want. We can have thermal or non-thermal settings for our ultrasound. But if we keep the sound waves stationary all at the same point, then we can cause a collision of these sound waves, and that can cause damage, and we're going to be really careful about that. It's called cavitation we'll look at. So 5 characteristics of ultrasound that we're going to talk about: frequency, duty cycle, intensity, effective radiating area, and then beam non-uniformity ratio. So frequency is going to help us figure out the penetration depth of ultrasounds. 1 megahertz is going to penetrate the deeper structures, between 3 and 5 centimeters, up to 5 centimeters of penetration depth. So again, we're penetrating the deeper tissues with this, so that's nice. 3 megahertz frequency is more for the superficial tissues, 1 to 2 centimeter penetration depth. The duty cycle is the percentage of on time. So just like with our diathermy, we could have continuous and it's always on, or we can have pulsed where the machine itself is flicking its on and off switch internally. So same thing for ultrasound. We can have a thermal setting, which would be the continuous setting, or we can have the non-thermal setting, which we're going to tell the machine, hey, flick your on and off switch really quick. The on and off ratio on some machines you can change. The most common is 20% on cycle, so it's only on for 1/5 of the time. Some machines you can adjust that up to 50%. Most research shows that 20% is the best, most effective, than better effectiveness than 10%, better effectiveness than 20%. So that's what is used. I don't think I've ever seen pulsed use anything other than 20% on cycle. Intensity is just the amount of power we're putting into that head, into the transducer, and into the tissue, measured at watts per centimeter squared. Most units are going to go up to 3 watts per centimeter squared. In general, the more acute, the lower intensity. That makes sense for everything we do, right? The more acute the problem, the less we mess with it. But I have some exact parameters we'll go through in a little bit. The effective radiating area is the area of the transducer which the ultrasound will radiate. ERA is always slightly smaller than the size of the transducer head itself. It's determined what's happening with these ultrasounds. We have a piezoelectric crystal that's vibrating back and forth. That's what's creating the sound waves. So it's the size of that crystal is the effective radiating area, not the size of the ultrasound head itself. Beam non-uniformity ratio. This basically just means that there's not going to be an even spread. So even though the ultrasound heads are flat, it doesn't mean it's delivering the same amount of power evenly throughout the entire area. It's non-uniform. Here's a couple of pictures of the beam non-uniformity ratio. The FDA regulates that it should be less than 6:1 ratio. So that there's a hot spot which receives roughly 6 times higher intensity than the set intensity. So it can be hazardous to regenerating tissue. Another reason why we keep our ultrasounds moving the entire time for it. So the big thing for ultrasounds, the hands-on practical, how do I do this? The number one thing we're going to be looking at is making sure you're always moving that sound head as it's applied to your patient. It has to be moving. 1, because we don't want one hot spot staying in the same place the entire time. 2, we don't want the collision of these sound waves creating a problem. We'll look at what that is in just a little bit. So what we're doing is creating a cavitation. So cavitation is the term for this compression and expansion of molecules. We're creating micron-sized, incredibly small-sized gas bubbles in the fluid with this sound field. Those bubbles shrinking, expand like we saw with that glass. We want stable cavitation, which means we got this compression and expansion of these molecules, and that's going to be helpful for our tissues. It's going to increase cell membrane permeability. There's going to be, if we want the thermal effect, we can create some thermal effect with it. The unstable cavitation, when we keep that sound head stationary, that is harmful to tissues. The gas bubbles collapse violently under pressure. They can be destructive to tissues. Occurs more readily at the deeper settings, so we have to be even more careful when we're at the 1 megahertz setting. But as long as we're moving our sound head, we'll be safe. We're no problem with that. It's when we keep it still. Now, I will tell you the thing that's tricky. What do you got, Rob? What's the matter? You look. It is there. I switched it up. I just uploaded the new PowerPoint. So if you downloaded it. Yeah, I switched some of the order around with what I wanted to teach. I didn't like the order before. So it is in there. There is another one uploaded to Blackboard if you wanted to get the new one. So We always keep the sound head moving. As long as we're keeping the sound head moving, our patient is safe. We are fine. The times we're going to like have a problem is when we're applying the ultrasound, we're moving it around, and then we have to take our attention to the dials or the machine to adjust a setting or to press the start button. So if you can't pat your head and rub your belly at the same time, you're probably going to have a little bit of trouble with that. So it's going to just take practice. I know we can all get it. We're going to look at ways to do it. We're going to practice a bunch. We can practice it with the machine off. If you're one of those people that are really having trouble, you don't have to turn the machine on. Keep the off switch and try to do the two things at once. Who's cooking dinner tonight? So you can do it as you're cooking dinner, right? So, stir your pasta as you're messing with your temperature settings. Set a timer as you're melting your butter, right? There's ways you can practice this. Whatever you're making, make extra. We'll have it for next week. What are you making? Mashed potato. Bring it on in. I'm a mashed potato king. That's it. You just got right to my heart with mashed potato words. Oh, I might have to sit down. So some of the therapeutic effect of ultrasound, we're going to destabilize the cell membrane, increase the cell permeability, increase macrophage activity, release of histamine, angiogenesis, create new blood flow. So all of that stuff is the beneficial effects for it. So some of the applications, we're going to talk a lot today about thermal versus non-thermal. That's what I want to focus on for today. Next week, we're also going to talk about what phonophoresis and how we could use ultrasound underwater. Later in the semester, we're also going to look at combo ultrasound, which takes the electrical stimulation and delivers it through the sound head. That's kind of cool. So thermal, we're going to generate heat. It's a lot like diathermy. Gentle warmth is what the goal would be. High intensity continuous ultrasound, more heat's generated more superficially. So at the 3 megahertz, the more superficial, we definitely should be eliciting some of that warm sensation. Deeper, it might be a little bit tougher to feel, but that's the goal, is to generate heat and to generate that sensation. So energy absorbed in relation to tissue density. So the denser the tissue, the greater absorption of that ultrasound. So if we have scar tissue and we need to put ultrasound through that scar tissue, we might not be penetrating that depth that we need to. Joint capsules, tendons, and ligaments will also absorb that energy more readily than a structure deeper to that. So that's good if that's the target that we want. Tough if we have to go through those things to get to the tissue we want. Good to use anytime heat and stretch are indicated. Our purpose is to increase tissue temperature and length of the tissue. So what kind of conditions are you thinking of? First, acute or chronic? More of the chronic line, right? Because in acute injuries, do we want to create a heating effect? No. Nope. So more chronic injuries, and anytime we'd want to increase the pliability of tissue and the increased tissue temperature. So some things, muscle spasms, trigger points, connective tissue contracture, adhesions, unresolved hematomas, maybe, and other chronic conditions can be helpful with it. Non-thermal. Good for, so we're still getting some of the cellular stuff that's happening, increasing the cellular membrane, increasing macrophage activity, but not with the thermal effect, because we're turning the machine off 80% of the time. So good for tissue repair, good for acute inflammation. So more acute injuries, we can still do ultrasound, but we want the duty cycle to be at 20% and not anything else than that. So acute, subacute inflammations, bruising, muscle tears, burns, superficial and deep wounds. We can do it with wounds, although there are special like coupling gel sheets that we need to cover the wound with, so we wouldn't actually come in contact with the ultrasound head and the wound. I don't see that very often. But it is one of those things, whoever's interested in wound care, there you go. You got another trick for your wounds. All right, so looking at this picture here, what do you guys think? Where in the pain cycle are we affecting with ultrasound? Let's start with thermal type of ultrasound. Potentially muscle guarding, ischemia, generating more blood flow. Good. Anything else? Non-painful stimulus. So if you haven't seen ultrasound, what's that? So with thermal ultrasound, I think we're definitely getting to the muscle guarding, getting to the ischemia. That's wonderful. Anything else? So we did talk about non-painful stimulus. I'll get back to that. Anything else? Clearing metabolic waste, definitely. How about non-thermal, where the duty cycle's at 20%? Potentially at the edema and probably the metabolic waste. That's really at the cellular level we're driving that stuff. Now, the other great thing about it, the benefit, I think, and this is a personal opinion, I think the benefit of ultrasound over laser is the non-painful stimulus. So what we're going to do is we're going to take our ultrasound head. Here's our ultrasound head. We're going to apply a coupling gel with it. We're going to apply a coupling gel to the ultrasound head itself. We could apply it to the patient too, either way, as long as we have it. And then we're going to be driving this around, always moving around the area that we want it to. So the effective radiating area is slightly smaller than the size of this sound head. If to bring it back to that. Now, the great thing about this too is I could stay very superficial as long as I'm in contact, I'm doing the job. Or I can drive a little bit more pressure with it. And now I'm even introducing more of that non-painful stimulus, using this almost like a massage technique. And once we do massage techniques, you can say, okay, like, is there a specific technique I can also use with this? So that's what that is.
Cover over that, or do you just put the gel right on it?
Gel right on it. Yeah, we'll look at that in just a little bit. We'll play with it.
Yeah, I have a question. I'm just like, so in this like pain cycle.
Yep.
Like diagram. It's not painful stimulus, just in general, like, that's always something that's there.
Non-painful,
Or is it in this cycle?
non-painful stimulus would be interjecting, blocking the T cells in the dorsal horn. That's where the non-painful stimulus attacks the pain cycle.
Okay.
And that's where I think our laser, what do you guys think of non-painful stimulus with laser? Not really. Yeah, like, yes, we put the laser on and we keep it still. Yeah, I can play around with the amount of pressure, but I don't have a, yeah. Although when we look at emotional factors, prior experience, patient perception, we could be playing with that an awful lot with laser. Anyway. So some contraindications, cardiac pacemaker during pregnancy. Different sources have different rules for pregnancy. Some say any pregnancy, any ultrasound is contraindicated. Others say, well, you can be pregnant, just don't use it over pelvic, abdominal, or lumbar region, staying away from the growing baby. So if somebody had an ankle sprain and was pregnant, you could do it to the ankle sprain. Some textbooks have different guidelines for that. Over eyes or reproductive organs, any active bleeding or infection, tumors, malignancies, always deep vein thrombosis, thrombophlebitis. Over the heart, I don't know what the stellate is. You guys know what that is? I wrote that last year. I learned it last year and then did not look at it again this year. Over epiphyseal plates over a growing bone. So the kids, we want to stay away from it as well. Precautions, Again, I put precautions in pregnancy as well, because again, some textbooks say pregnancy is an absolute contraindication. Others say just stay away from, abdomen, ankle, and low back. One textbook I looked at said stay away from the ankle because there's an acupuncture point in the ankle that could create and could induce contractions. I only saw that in one textbook. So here's where my thinking is with ultrasound and pregnancy. I don't do it. I stay away from it. I don't do it. I think there's other things I can do. I also, what duration of time is pregnancy?
9 months.
9 months. I think unless you're working with an elephant, how is the gestation period of elephants? 2 years. 2 years, yeah. 24 months, elephant gestation period, yeah. Yeah. Anyway, let's get back to humans. I don't do ultrasound with my pregnant patients because I can do it later. I can do it in a few months. If it's still a problem, I'll do it in a few months. I also think I have other modalities that pregnancy is not contraindicated that I can attack this with. I just think I have other things I can do. So I don't do it. I would suggest that if you have a pregnant patient, even if they just have a hamstring strain, I would advise you to be incredibly cautious and make sure that you exhaust all other treatment avenues first before you dip into that. And then you might kind of say, all right, well, come back in 2 months after you're done with this, and then we don't have a problem with that. So, so that's what my thinking would be. Did you have something else, Michaela? Oh, okay. Yeah. Stay away from sympathetic nerve. We don't want to stimulate the sympathetic nerve system. Yeah. Thank you for looking that up. So we want to maintain even contact. We always want to be moving, but you don't want to be moving like this, where you're getting the ultrasound head off of the patient. You always want to have firm contact with that patient. Stay off of bony prominences. It's going to reflect the sound energies, and the tissue in between the ultrasound head and the bony prominence is at high risk for that unstable cavitation because the sound energy is bouncing off of the bone. Avoid discomfort, any plastic, metal, implant, or cement. That's a precaution. So I wouldn't do it. I wouldn't do ultrasound over a knee replacement, right? That artificial metal and plastic, but I can do it to the gastrocs as long as I'm staying away from it. So stay away from the metal or plastic implants. Recent fractures, epiphyseal plates we've talked about, open wounds, peripheral vascular disease. So our parameters for this, so I broke this into chronic injuries or acute injuries. Chronic injuries, we want the thermal effect. We want to set it into continuous. Our next decision is how deep is this tissue? A little bit easier than our laser parameters. We just have to figure out, is this superficial or deep? It's a kind of binary, superficial or deep, yes or no. It's pretty easy. The intensity, how much watts per centimeter squared we want. If it's 1 megahertz deeper structure, we're going to use between 1 and 1.5 watts per centimeter squared. Machines can go up to 3 watts per centimeter squared. If we're superficial, we're always going to use 0.5 watts per centimeter squared because we're at higher risk for burn with higher intensity. So you want, because the sound is being absorbed really superficially, you want to make sure we're at 0.5. The effective radiating area of the to get that thermal effect is 2 times ERA. So the ERA is slightly smaller than the size of the head. So it's not quite, we'll call it though, 2 times the size of the of the ultrasound head. So not a large area. There are different sizes of ultrasound heads. most of them are this standard size. So we're not talking about a huge area here, but fairly big. Yep. The treatment area is slightly smaller than 2 times the size of this head. Yeah, so if we took a tape measure and we said this is 4 centimeters across, I have an 8 centimeter circle I could effectively have a thermal effect for. If I go further than that, I'm not heating the tissue and I'm not generating enough heat of the tissue. Just like if we were to slide that hot pack around. That's all we're doing here is sliding the hot pack around or moving the diathermy machine. Like, no, we want this area to be heated up. The time we do it for 5 minutes for every ERA. So if you are radiating 2 times the area, it's 10-minute treatment. Better than diathermy, well, shorter time than diathermy, not quite as fast as laser. Big benefit of diathermy over thermal ultrasound. I don't have to be there. Yeah. I gotta be here for 10 minutes. Jeez, what do I want to do? Do I want to be here for 10 minutes or do I want to be away from this person for 30? I got notes to do. I'll go do that. Yeah. So maybe you guys have other decision making for that. For acute injuries, we're going to have a pulse setting. Again, pulse setting should be 20%. You have other options, 10 to 50%. 20% is the most researched, most beneficial. I don't see a reason to ever change that. But you'll, at some point in your careers, you're going to send me an email and say, hey, God, Josh, guess what I got to do today? I got to change the pulse setting to 50%. And here's why. And I'm going to say, wow. Don't ever email me again. No, I would never say that. So our decision making is this acute or chronic? If it's chronic, we want tissue heating. If it's acute, we want the pulse setting so we get some of the therapeutic benefits without heating. My next question is the tissue superficial or deep? If it's deep, 1 megahertz. If it's superficial, 3 megahertz. The intensity is going to be between 0.8 and 1.0 watts per centimeter squared, regardless if you're superficial or deep. It doesn't matter. The effective radiating area is just under 4 times the effective. The treatment area is less than 4 times effective radiating area. So again, if this is 4 centimeters across, all right, well, 4, 8, 12, 16. So we have a larger area than if we want the thermal effect. So that's kind of nice if we have a bigger area for it. But the downside is we still want 5 minutes for every effective radiating area. So if you are doing that wide area, that just under 4 times effective radiating area, well, we're here for a while. And I think if we are attacking that large of an area, if we have a diathermy, that's probably the more effective because the time is the same and that probably makes a little bit more sense. Although more clinics will have ultrasounds than diathermies. Do you have a question, Michelle?
Do this because you're getting so much more of the involved, or would it not harm it?
As long as we're not over bony prominences, then it's okay if we go bigger. I can also keep, let's say I want to do pulsed, but I'm really focal. I can keep this in a small area as long as I'm constantly moving the sound head. I will be okay. Not a lot of time. I don't have the exact, I'll see if I can find the exact answer somewhere. It's not a lot of time. All right, to document, we want to document the location, not location of your clinic, but location on the patient's body. What did I do this to? And then document your parameters. What was my frequency, intensity, duty factor? How much time did it take? And then patient response. If you do not write patient response to me, if I'm the next clinician, I'm not doing ultrasound next time. But if you write in your notes, patient had great therapeutic effect, commented how much better pain felt, like, all right, now you're convincing me to do it. So some guidelines: set the time and intensity controls to 0, set your watts per centimeter squared, then you can start turning it up. Some machines have different settings too. We'll have to play with that. Again, you can practice moving the sound head and operating the buttons without the machine on, okay, to get used to that kind of mechanical process to it. Pulsed ultrasound should be no sensation other than the sound head gliding over the patient's skin. Continuous heating, mild heating will occur above 0.8 watts per centimeter square. It should be mild warmth, not hot. Another thing would be that deep aching. That's a sign that we're heating the tissues too much. So it shouldn't have any of that. It should be gentle warmth. Bless you. Discomfort should not be experienced during the treatment. Pain, again, we're creating too much heating, too hot, causing a burn. Keep the transducer head moving at all times. Always keep in contact with a suitable medium. So we're using this ultrasound coupling gel. We want 1 to 2 millimeters of gel on the patient, between the patient and the sound head. Overlapping circles or linear paths. Should be parallel to the tissue surface for good contact. Again, we talked about that earlier. Maintain good contact. Don't have some aspects of the sound head off of the patient. If there's some complaint of discomfort, my first step would be to lower the intensity and increase the frequency. Again, get more superficial with lowering the intensity. The other thing we want to do for our patient is protect. We want to have towels because we're going to need towels to wipe up the ultrasound gel, but we're also going to be tucking it into any clothing to make sure we're protecting the clothing of the patient. We don't want walking around with ultrasound gel on your shirt all day long. It's no fun. All right, that's time. I already talked about that. We'll talk about phonophoresis next week, I think. So what we're going to do next is we're going to play around with a bunch of our machines. Some of the settings on it are, how we use this machine versus those are a little bit different. I really like this machine for ultrasound. Really simple. I haven't played with those in a little bit. I think we have another one over there. We do have one other machine. I think it was made in 1947. We'll straight break that one out. Now, one thing I want to say about all the machines. So for your skill comps practicals, use a machine you're comfortable with. If you like this one over that one, I think for diathermy, those ones were a little bit easier to operate than the Chattanooga ones in general, right? So grab the machine you're comfortable with, but play with all of the different kinds, because what happens sometimes is those machines, like if they need to be repaired, the vendor will drop off their loaner ultrasound machine, and it's going to be a lot different than what you've got. It's just something to use while they repair yours, and you have to adapt to it. So don't be afraid of how this machine works versus another one. But make sure you have a good variety. But for testing purposes, use what you like. Okay. All right, so let's play around with this. The big thing is keeping the sound head moving and then playing with the times for it. So at first, let's just start something really superficial, really light settings, make the duty cycle 20%, keep everything nice and safe. Just really your first step is getting used to moving the sound head as you're operating the machine. Okay.